Policy Manager for One Colorado, and we're going to talk about healthcare. So for most people, healthcare is pretty scary. Most of us aren't taught how to navigate through the process, and oftentimes we're left to just figure it out as we go along. And for LGBT people, healthcare is really scary. We don't know what kind of discrimination we're going to encounter, or if providers are going to be culturally responsive to our needs. And for transgender people, healthcare is absolutely terrifying. You have all that, plus not knowing if the doctor's going to use your correct name and pronouns, or if your health insurance is going to cover your basic needs. So in 2011, One Colorado released an LGBT health report, and it found that 55% of LGBT Coloradans were afraid of accessing healthcare because they didn't want to encounter discrimination or bias. And that 61% of transgender Coloradans did not seek out needed medical care because of that fear. One Colorado said this is absolutely unacceptable and we're going to do something about it. So they hired a full-time staff member to take on inclusive healthcare in Colorado and build our coalitions and allies across the state. We work mainly with the Consumer Health Initiative, which are the health policy and healthcare reform experts. And they don't work just with LGBT communities, they work across the board. And then we also work with the GLBT Community Center of Colorado, particularly their transgender programs manager, Courtney Gray. And they were the access to the community. They made sure that trans voices were at the table. We also developed the Colorado LGBT Health Coalition, which was made up of 30 statewide organizations and state agencies, again, not specific to LGBT issues, to help us. And there was a secret recipe that made this, the timing in Colorado, the right time. One thing was the passage and implementation of the Affordable Care Act, also known as the ACA, also known as Obamacare. And the Affordable Care Act did two things in Colorado, because we chose to do them. One, it expanded Medicaid to make sure that lower income LGBT Coloradans were getting coverage they never had before. And two, it created a state-run marketplace that made buying private insurance a little bit more transparent. Now, Colorado also has an inclusive anti-discrimination law that protects sexual orientation. And in our state, sexual orientation is defined as heterosexuality, bisexuality, homosexuality, and transgender status. We know that's not the most ideal language, so if you're doing non-discrimination policy, don't try to just throw it in. Now, Colorado health insurance law prohibits discrimination against sex, and sex is defined to include sexual orientation, which in Colorado includes transgender status. Okay, so we have these laws and we have our allies, and we wrote a letter to the Colorado Division of Insurance, who oversee and regulate private insurance companies in Colorado, and said, what are you going to do about the transgender people being discriminated against in healthcare coverage? And in response to that, they released a bulletin number B4.49, I had to memorize these numbers, and what that bulletin said was that transgender exclusions in healthcare are discrimination in two ways. One, medically necessary care is a decision between a doctor and a patient, and not for a health insurance company to decide. And two, if you're providing services to a cisgender person or a person who is not transgender, you better provide those services to transgender people as well. And once that bulletin was released, we saw exclusive policies kind of fall like dominoes. So the Colorado Health App is a nonprofit insurance carrier in Colorado, and they started out with no exclusions in their policies. They're the ideal. Kaiser was actually sued and settled out of court when the Colorado Civil Rights Division said their exclusive policies were discrimination. And then Anthem did not want to be sued, so they were like, we're removing our transgender exclusive policies. And then the Colorado Association for Health Plans has membership of the 10 largest health insurance companies in Colorado, and they said all their members will be removing their transgender exclusions by 2015. So we've seen huge improvements across Colorado in insurance. And I'm not saying things are perfect and better overnight. We're still seeing various implementation, but we do know in the past year and a half, so many Coloradans, or transgender Coloradans, have had tremendous impacts to their access to inclusive coverage, and just tell us how important it is and how much more care they can receive and how much better they feel in accessing preventative care. So if you have any questions about what we did and how we did it, come talk to me. And also we have a transgender health survey to make sure that we're capturing the stories of transgender folks, because most national or state level surveys don't collect data on gender identity.